live thing here. Share screen. अरे बीजी विंडो क्या थी यार हमारी
जरा क्लिक बंद कर देनी जरूर નથી બાકી કોઈ તમારી સ્ક્રીન બંધ કરી
ના જરૂર
શબ્દ ની બંધ કરી
ના 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 કઈ વાંધો
નહીં રિક્વાયરમેન્ટ છે ને અત્યારે
નો પ્રોબ્લેમ. Yes, good afternoon. Is my voice clear and audible to you? Write down in chat box. Is my voice clear and audible to you? Is my voice clear and audible to you? We are going to discuss today about primary health care, then national health policy, then brief about Millennium Development Goal as well as Sustainable Development Goal. So ask your colleague, those who haven't joined yet, to join the class. So we are starting. Recording of this lecture will be also available. Link will be also available in group later on. So first of all, primary health care. You have already come across various levels of prevention, and in that also there is one terminology, primary prevention. Here we are dealing with different level of the care. You know that primary health care, secondary health care, tertiary health care. Today we are going to focus on primary health care, right? So you know that primary health care is delivered by our primary health setup in form of primary health centers as well as urban health centers. So we are going to see first of all in brief about healthcare revolution. As you know that before independence, or if we take back about 30 years back, then health services were not as up to the level as we see today. So at that time, standard of the health services was not according to the expectation of the public. Actually, healthcare was in evolution form, right? It was in evolution form. In that era, there was no technology, there was no digitalization. So the level of the healthcare was not also according to the level which we see today. Services at that time did not cover entire population. So as we know that today we can reach up to the level, up to the area where people are living far behind, where people are living in the interior-most part of the country, where interior-most part of the villages, hilly area, as well as on the island, we are also covering vaccination services and other healthcare services, right? At that time, it did not cover entire population. As we know that health is the fundamental right of any person, right? So proper healthcare should be delivered, which is there in our national health policy, various documents also. Lack of services in rural area were there, where majority of the people was living. It was the time of it was the time way back before 20-30 years, right? Nowadays, even in rural area where there's enough services, healthcare services are being delivered. So one by one, some students have joined. Ask other students of your batch as well as those who are interested to join the class. It may be very interesting to discuss this topic. It may be very interesting to see these topics, right? There may be unnecessary reduplication of the services to privilege urban dweller, right? So nowadays it is also there that reduplication means once the service has been provided, then another time also that service, vaccination has been provided by mistake, another time also that vaccine is being given. That is called reduplication of the services. Many a times health survey, we come across various health survey, right? So that health survey has been also reduplicated. So that has been there in urban area, right? There is gross disparity between health services in between rich and poor. It is also existing today between urban and rural area. Thus, as you know, that tertiary healthcare services, large hospitals are there in urban area, in mega cities, in cities area, while in case of the villages or in the taluka level, there is only primary health center or community health center. Also, the poor cannot afford the costly services, rich only can have the services of that, right? So there is gross disparity between classes as well as between locality in healthcare services, as well as the services are different between nations also. Whatever the services we are getting, the service of the Bangladesh people or the people in Pakistan may be getting the different kind of the services. In developed country, there may be many other developed technologies due to which healthcare services may be more in good in quality, right? So it has resulted in demand for the better health system, and our health system, it is getting better day by day. Whatever it was there before 10 years, it has been improved to a lot in this last 10 years, particularly if we talk about. So some history is there, although it is applicable for the year 2000. But as a medical person, you should also know that this health for all, it was the goal, social goal of the health services by the year 2000. Nowadays, we are talking about Millennium Development Goal, as well as now most recently, it is about Sustainable Development Goal. But there was one agenda that health for all should be delivered to all by the year 2000. It was by Alma Ata Declaration. So it intended to deliver the health services to all. Health for all means intention is to deliver the health services to all. Aim is development of the health, development of the nation, development of the people, development of the country, right? So health for all, it is based on the concept of equity of the health, means health should be delivered equally to all the persons. So definition of the health for all is to bring to within the reach of the every one. Health should be brought within the reach of the everyone in the given community. And it was declared in World Health Assembly resolution. So according to this World Health Assembly resolution, the health for all means it is the main social target of all governments and WHO in the coming decade should be the attainment of the level of the health by all citizens of the world by 2000. So there at that time it was declared in May 1977 that by year 2000 level of health should be attained by all the people on the planet, right? Which kind of the health? Of a level of the health which will permit them to lead a socially and economically productive life. So all the people should be healthy, and that healthy people should be able to produce socially and economically productive life. So that is called as HFA 2000, means health for all 2000 by 2000 AD, right? It aims to provide rehabilitation for all. So health for all at that time had two perspectives: long-term concept and immediate context. So in long-term context, realization of the WHO objective of the attainment of the highest possible level of the health by all the people. So long-term context was that highest possible level of the health, you know, that positive health, right? Free from disease. So that is the highest possible positive health level should be obtained by all the people in the community. Immediate context of this health for all was all people in the world should have at least such a level of the health that they are capable of working productively and of participating actively in the social life of the community within which they live. You know that there is saying that first happiness is our health. If we are healthy, then we will be able to live happily. If we are healthy, then we will be able to work productively. If we are healthy, then our social life will be also healthy. So here immediate context of health for all was also same, that level of the health, such a level of the health should be obtained by all the people that they should be work productively, they should be participate actively in the social life in the community in which they live. So this health for all had 17 objective out of 14 were related to MCH. MCH means that is maternal and child health, and 3 were level were according for the control of the tuberculosis, leprosy, and blindness. So it also included one important topic, this Alma Ata Declaration, Health for All. It also included primary health care. It was the part of this Health for All as well as Alma Ata Declaration, and it was accepted by the member country of the WHO. You know that almost all the countries are member country of WHO as well as World Health Assembly as the key objective to goal for the Health for All by 2000 AD. So that is about the history about Health for All. So healthcare, it is an expression of the concern to fellow human being, right? Definition of the healthcare: multitude of the services rendered to the individual. So many of the services, multitude means multiple services rendered to the individuals, families, communities by the agent of the health services. Here agent means what? Agent means it can be doctors, it can be nurses, it can be, here agent word is misnomer. It is not like we are using this word in trade or in case of the business, right? It is the staff of the health services. It is the participants of the health services who are delivering the health services, right? They are considered as the, so all the healthcare staff. Here we can read agent as healthcare staff. By how? By promoting, maintaining, monitoring, and restoring health, right? So multitude of the services they render to the individual, family, community by the staff of the healthcare services for promoting, maintaining, monitoring, and restoring the health of the community. Aim of the healthcare: people are being served, helped, diagnosed, cured, educated, rehabilitated by healthcare personnel. But most of the time what we are doing, that we are delivering only this curative services. Along with the curative services, healthcare also aims to maintain the or rehabilitate or educate or help or diagnose the people of the community. Healthcare is a government function in many nations and now included as the disease prevention, control, and food safety also. So in many aspects of the program, that food safety is one of the example, that here also there is concern about the healthcare, water safety, about pollution, prevention of the air pollution, right? So all these are component of the healthcare services. So characteristic of the healthcare: first characteristic is it should be appropriate, right? Relevant. Whatever we are delivering, it should be appropriate to the community. For example, if in community the major prevalence is about diarrheal disease in children, so we should have the services which are aiming to provide or which have the objective to provide prevention of the diarrheal diseases, right? So suppose in a community there is diarrheal diseases, they are more common, and we are delivering the services, or our healthcare staff or our resources are directed for the prevention of the dengue or corona, then it will not be appropriate. Nowadays, if the corona is more prevalent, then our healthcare should be it should be in direction of the working towards decreasing the corona, right? Comprehensiveness: healthcare services should be comprehensive, right? It should be adequate, it should be available, right? Adequate means here also adequacy includes adequacy of the healthcare setup, adequacy of the all the equipment, adequacy of the healthcare staff, adequacy of the drugs, medicines, etc. So many things are there in adequacy. Availability: it should be available all the time. If you are going to the PHC and doctor is not available, then you can say that it is not availability. Healthcare is it doesn't meet the availability criteria. It should be accessible, right? So it should be accessible to the innermost or interiormost part of the country, right? So you know that nowadays PHC, healthcare centers, that health and wellness center, they are also accessible to the all the population. They are made in such a way that they are easily accessible to all the people in the community. It should be affordable. In government, as we know that majority of the services are being delivered free of cost. So it is affordable, right? Feasibility of the person. So it should be feasible to all the person. So again, I repeat, characteristics of the healthcare. You should remember 1, 2, 3, 4, and 5. 5A, 1C, and 1F. So appropriateness, adequacy, availability, accessibility, affordability. Then it should be comprehensive. It should be feasible. These are the characteristics of the healthcare. There are 3 levels of the healthcare, as we know. Primary healthcare, or it is also considered as the essential healthcare. It is the basic healthcare services. It aims for prevention of the common ailment. It helps. It is also, it has the also objective to for having the secondary level of the services, means it's for common ailment, cure and treatment, right? Treatment and diagnosis and treatment of the common ailment. It is also one of the objective of the primary healthcare. Since secondary healthcare services or intermediate level of the healthcare services, right? And tertiary healthcare level services in form of the super specialty or specialized healthcare services, right? Each level is supported at the higher level, means primary healthcare is supported by the secondary healthcare is supported by the tertiary healthcare, which is the apex level, right? Healthcare is the public right, and government should provide this care to all the people in equal measure, right? So characteristics of all these three type of the healthcare here: primary healthcare, secondary healthcare, and tertiary healthcare. Let me check how many students are online. Okay, so for all the rest of the students, it will be available, but it is very interesting to attend live. Right? So we are continuing. Okay, so here primary healthcare deals with prevailing health complaints. Are you able to see the slides clearly? Write down in chat box. Are you able to see the slides clearly? Okay, so primary healthcare, it is deals with the prevailing health complaint. Secondary healthcare is more, it is aiming for the our objective is to prevent more complex problem. It is dealing with the more complex problem. And tertiary healthcare, it is dealing with the super specialty care, right? Primary healthcare is provided by PHC, that is primary health center, sub center, or nowadays we can call health and wellness center. Many of the PHC as well as sub center, they have been now labeled as the health and wellness center, right? As well as by community participation. Secondary healthcare services, they are delivered by district hospital. As you know that in Junagadh district or in Rajkot district hospitals are there in all the district places, Jamnagar district, right? So all the district hospital communities health center, CHC. By tertiary healthcare, it is delivered by regional or central level institutions. So primary healthcare provide essential healthcare services, means basic healthcare services, prevention and treatment of common ailments like vector-borne diseases, like food-borne diseases, like waterborne diseases. Secondary healthcare, it provides essentially curative services. Right here in primary healthcare, more component is about the preventive health services. Right, in secondary as well as in tertiary healthcare services, there are curative health services. And additionally, tertiary healthcare also provide planning, managerial skill, teaching, super specialty care. Right, so medical college hospitals, they are considered as the tertiary healthcare level of the services. Right, AIMS, that is also a part of the tertiary healthcare services. That is also one district hospital, secondary healthcare services, and that is multi-specialty hospital, that is tertiary healthcare services, right? So primary healthcare is the first level of the contact of the individual, family, or community, right? So whenever we suffer from any ailment, where do we go? We go to the we don't directly go to the super specialty hospital or directly to the medical college hospital. We generally go to our nearby primary health center. In villages, commonly they go to the PHC, or in our city, we usually go to urban health center, right? So it is very close to the people. PHC, sub center, UHC, they are very close to the people and dealing with the prevailing health complaint and problems, right? Healthcare will be more effective within the context of the area's needs and limitation at this level. It integrates all the factors required, like promotive, preventive, curative services for improving the health status of the population at the community level. right? So it integrates all these factors, right? Promotive services, preventive services in primary health care. There is also promotion of the health, like in form of the good exercise, in form of the care, right? So nowadays, you know that one bridge course, that is triple CH, community certificate course in community health. After passing it, person becomes CHO, that is community health officer, right? He has all this duty in form of the promotive health services. He has to also perform the yoga classes. He has to also perform the exercise for the community, right? He has to involve community in exercise as well as improving the dietary care of the community, right? Preventive health services in form of the prevention of the vector-borne disease, prevention of the foodborne disease, curative health services, treatment of the common ailment like diarrhea, vomiting, or gastroenteritis like malaria, dengue, right? So that is the function of the primary health care. We're not going to read. I'm not going to read all these things. One important part is there. In 1978, the concept of the primary healthcare has been evolved, which was following an international conference held by WHO, UNICEF, right, at Alma-Ata, right? Alma-Ata, that is Almighty. That is the name of Almighty, which is there in Kazakhstan. And that conference was held, and the name of the conference thereafter is Alma-Ata Conference, right? So you need to remember that. It can be asked in your MCQ also. So this concept of the primary healthcare has evolved in 1978 in Alma-Ata Conference, right? So this is essential healthcare, which is based practical, scientifically and sound and socially acceptable method and technology made universally accessible to the individual and family in the community through their full participation, and at a cost the community and country can afford to maintain every stage of the development in spirit of the self-determination. The definition is very much long. Repeatedly you have to read that. I am going to explain this very briefly. It is the essential healthcare service, which is based on science. Scientifically, it is based, right? It should be acceptable. It is based on acceptable methods, technologically accessible, technologically safe method, right? It should be universally accessible, what we have already told. Then it should be through community participation, right? And at an affordable. So here, all the principles or characteristics of the primary healthcare are there. It should be acceptable. It should be affordable. It should be accessible, right? So all these component of the primary healthcare are there in definition. So this Alma-Ata Declaration has described these elements of the primary healthcare, right? Education concerning the prevailing of the healthcare problem, promotion of the food supply and proper nutrition, adequate supply of the safe water and basic sanitation, right? Maternal and child health care, including family planning, immunization against the major infectious disease, prevention and control of the locally endemic diseases like malaria, tuberculosis, leprosy, filaria, fluorosis, goiter, etc. Appropriate treatment of the common disease and injury, right? So all these covered: maternal and child health, immunization, commonly endemic disease, right, including communicable diseases, provision of the safe water supply, basic sanitation, promotion of the food supply, all are the part of the elements of the primary health care, right? And there are 4 principles of the primary health care. It should be equitable distribution, means it should be distributed equally into all, regardless of the urban, rural, regardless of the rich and poor. There should be community participation. Community should participate in delivering of the primary health care also. Like you know that ASA model, it is one of the example we can say that community participation. All the members of the Panchayati Raj, Sarpanch, other sectors should also be there. So it is also there in intersectoral coordination, like other department, not only health department, like other education department, like engineering departments, and they should also be involved in delivering the primary health care. There should be also appropriate technology in primary health care. So these are the 4 principles you need to remember: equitable distribution, community participation, intersectoral coordination, and appropriate technology. And this primary health care, it was proposed by Bohr Committee in 1946. Remember that this can be also asked as an MCQ. Bohr Committee has recommended this primary health care. Okay. So I'm not going to discuss all the principles in detail, right? Equitable distribution. It is, I have already said that it should be equally distributed regardless of the rich and poor, regardless of the rural and urban, right? Then community participation, there should be involvement of the village health guide, trained eye, ASA, right? So these are the example of the participation from the community, right? They should be also helpful in delivering the primary healthcare services. Intersectoral coordination, I already told that health sector plus all other sector, education department, engineering department, industry, food, husbandry, animal husbandry, public work, communication, all sectors should be housing involved in delivering the primary health care services. Like it is considered as the health sectoral coordination. I can give you the example that 2 years back there was measles rubella campaign. It was held in schools, right, for 9 months to 15 years of the children. So the health department was delivering the vaccine, while the education department was arranging for the infrastructure for development of the vaccine, as well as they were training the teachers. They were training also parents, as well as they were motivating the students for taking the MR vaccine. So that was the involvement of the education department. So this example of the health and education department in intersectoral coordination. Right? Appropriate technology, I already told you. So primary healthcare in India, it is delivered by PHC and local resident, that is ASA, MPW, that will Anganwadi worker, and these are and that part that it is talking about. Right? So MPW, this photograph MPW, trained by ASA, Anganwadi worker, they are also trained in delivering the primary healthcare services. Right? It is the old photograph of the PHCs. I have intentionally kept some of the old photographs. Right? Nowadays the picture will be different. Right? You can see that all the people are there. Most of the people are there in white dress. Right? Nowadays there are different dress for Anganwadi worker, Anganwadi helper, for ASA. At that time ASA model was also not available. Right? So different dress are there for all the people. Here it was almost white. Right? So now another topic, national health policy. It is 2017, right? Previously also national health policy were there. It was there in 1983 and 2002. But I am going to discuss recent more national health policy, that is 2017, right? So health policy is what? It generally describes fundamental principle regarding which healthcare provider are expected to make value decision. So nation develop always healthcare policy. It describes what fundamental principles, that how we are going to deliver the health services, what will be the component of the health services, who will be delivering the healthcare services. That this is the health policy is the document of the intention that we are going to we want to deliver such type of the services. Right? Health policy provide the broad framework of the decision as well as guiding health action that are useful in the community in improving their health, reducing the gap between the health status. Right? So national health policy 1983 and 2002 have served well in guiding the approach. So this policy guide the approach for health sector in 5-year plan. Right? So now 14 years after last policy in 2017 was introduced, primary aim of the national health policy 2017 is to inform, clarify, strengthen and prioritize the role of the government in shaping health system in dimension. Objective of the healthcare national health policy 2017 is to improve health status through concerted policy action, improve the health status of the community in all sectors and expand preventive, promotive, curative, palliative and rehabilitative health services. So objective is to improve the health status, in short, of the community, and as well as expansion of the promotive, preventive, curative, palliative and rehabilitative services. Principle of this policy are actually this national health policy 2017 document is very large. You can download this document also, but I am just briefly, as the purpose of the UG level, I am describing some points only. Right? So some of the principles of this policy are professionalism. It also includes integrity and ethics. For each principle, we can talk about 15 minutes or more time. Right? I am just enlisting this principle. I have just enlisted that. Equity, affordability, universality, some of them are the part of the primary healthcare, patient-centered and quality of the care, accountability, inclusive partnership, similar to intersectoral coordination, pluralism, involvement of the health services of the IUs also, other health apart from the health services, apart from the allopathic health services, decentralization, dynamism, and adaptiveness. These are the principles of the health policy. You can just remember the names of the principles. We are not going into the detail of this. So you need to remember goals to be achieved in mentioned in this national health policy. It can be asked in your MCQ also, right? So national health policy 2017 has certain goals like increase life expectancy from current level of the 60.7.5 or somewhat more to 70 by 2025. Life expectancy should be increased to 70 by 2025. Establish regular tracking of the disability adjusted life year index as a measure of the burden of disease by 2022. You know, the daily, it is very important measure of the burden of the disease and most important burden of the disease. It should be established as an index as a measure of the burden by 2022. Reduction of the TFR to 2.1 at the sub-national and sub-national level by 2025. Currently it is 2.2. Reduce under 5 mortality to 23 by 2025 and MMR from current level to 100. Currently MMR is 113 and under 5 mortality it is around 36. So it should be reduced to 23 by 2025 and MMR from 113 to 100 by 2020. So it is the current year, right? Reduce infant mortality rate to 28 by 2019. It has been already achieved. Reduce neonatal mortality to 16 and stillbirth rate to single digit by 2025, less than 10, right? Achieve and maintain elimination status of the leprosy by 2018. We have already achieved leprosy elimination. We can call leprosy elimination at the national level whenever there is less than 1 per 10,000 cases. So it has been achieved at the national level. Now further aim is to achieve it at all the regional levels, right? Eliminate Kala Azar by 2017 and lymphatic filariasis by 2017. Achieve this global target of 2020, which is termed as the target of the 90-90-90 for HIV AIDS. Means there should be 90% people should know their HIV status. Among them 90% should be put on the ART, and among them 90% should be having the control of the, I mean to say, it should be they should be stick to the ART treatment. It is called as the 90-90-90 principle. To achieve and maintain cure rate of greater than 95% in new sputum positive patient for TB and reduce incidence of the new cases to reach elimination status by 2025. To reduce the prevalence of the blindness to 0.25 per 1,000 by 2025. To reduce premature mortality from cardiovascular disease, cancer, diabetes, chronic respiratory disease by 25% by 2025. Increase utilization of the public health facility by 50% from the current level to by 2025. Antenatal care coverage should be sustained above 90%. Full antenatal care should be sustained above 90% in form of the delivering antenatal care services for minimum 4 ANC checkup, injection TD, right? They are also part of the antenatal care services. Skill attendance at the birth rate should be also above 90% by 2025. More than 90% of the newborn should be fully immunized by 1 year of the 2020 by 2025. Meet need of the family planning above 90% by this year. 80% of the non-hypertensive and diabetic individual at the household level should maintain the controlled disease status, right, by 2025. Relative reduction in prevalence of the current tobacco use by 15% by 2020 and by 30% by 2025, right? So that is reduction, right? 15% reduction by 2020 of the current tobacco use and by 30% reduction by 2025. 40% reduction in prevalence of the stunting of under 5 children by 2025. Safe water and sanitation to all by 2020 under Swachh Bharat mission. Reduction of the occupational injury by half from the current level of 334 per 1 lakh agriculture worker by 2020. So you have to repeatedly go through these numbers. It cannot be remembered by once, right? Increase health expenditure by government from existing 15% of the GDP to at least 2.5% of the GDP. Increase state sector health spending to more than 8%. Decrease in proportion of the household facing catastrophic health expenditure from current level by 25%. 25% decrease in out-of-pocket expenditure by 2025. Ensure availability of the paramedic and doctor as a part of IPHS norm in high priority district by 2020. Establish primary and secondary healthcare in priority district. Ensure district level electronic database. Strengthen health surveillance system. Establish federated integrated national information architecture, right, by 2025. So these were all goals of the National Health Policy 2017. You can repeatedly go through this goal and then remember. We are not going to see another detail of the National Health Policy. It is very wide document. Now we are going to see, sir, all part of the National Health Policy. Very briefly, we are going to see Millennium Development Goal. There were this goal were established in 2000 and which were to be achieved by 2015. There are 8 goals. You can see here with the help of the photograph. First goal is to eradicate extreme poverty and hunger. Second is to achieve universal primary immunization. Third was to promote gender equality and empower women. Fourth was to reduce child mortality. Fifth, improve maternal health. Sixth is to combat HIV, AIDS, malaria, and other disease. And seventh is to ensure environmental sustainability and global partnership for development. That is the 8th goal. So this goal were determined by United Nations and which were to be achieved by 2015. So this is again same thing. So after that, whenever these goals were over in 2015, right? In 2015, another goals were developed. These are known as Sustainable Development Goal, and which are to be achieved by 2030. Right. So on the base of this health for all as well as on Millennium Development Goal, Sustainable Development Goal has been developed, and this is the building of the United Nations, which is also projecting this Sustainable Development Goals. Right. So in the launch of this Sustainable Development SDG program, there were also many celebrities who took participation. And so this Shakira and David Beckham, that is football player, I think I have pronounced correctly. They had also participated in this launch of the SDG goal. These are the 17 goals. SDG goal are 17 goals. This 17 goals has 169 target total, and they have also more than 300 indicators. I repeat that SDG have 17 goals, 169 targets, and more than 300 indicators. So that is the UN headquarter, which has been enlightened with all these sustainable development goals. Again, this is the Assembly, UN Health Assembly, which was there to adopt SDG. Secretary General of the United Nations, Ban Ki-moon, of that time, when this SDG were evolved, various national health leaders have given their opinion as well as their acceptance in their speech of SDG in United Nations. You can see the representation from India as well as US and other countries. So SDG are based on Millennium Development Goal. So I'm quickly going through these goals. Goal 1 is to end poverty in all forms everywhere. Goal 2 is to end hunger, achieve food security, improve sanitation, and promote sustainable agriculture. Goal 3 is directly related to health, which is to ensure health lives, promote well-being for all at all ages. Goal 4 is to ensure inclusive and equitable quality education, promote lifelong learning opportunities for all. Goal 5 is to achieve gender equality and empower all women and girls. Goal 6 is to ensure availability and sustainable management of the water and sanitation for all. Goal 7 is to ensure access to affordable, reliable, sustainable, and modern energy for all. Goal 8 is to promote sustained, inclusive, and sustainable economic growth, full and productive employment, and decent work for all. Goal 9 is to build resilient infrastructure, promote inclusive and sustainable industrialization, and foster innovation. Goal 10 is to reduce inequality within and among countries. Goal 11 is to make cities and human settlement inclusive, safe, resilient, and sustainable. Goal 12 is to ensure sustainable consumption and production pattern. Again, I repeat that goal 3 is related directly to health. Other goals may be indirectly related to health. Goal 13 is to take urgent action to combat climate change and its impact. Goal 17 is to conserve and sustainably use the oceans, seas, and marine resources for sustainable development. Goal 15 is to protect, restore, and promote sustainable use of the terrestrial ecosystem, sustainably manage forest, combat desertification, halt and reverse land degradation, and halt biodiversity loss. Goal 16 is to promote peaceful and inclusive society for sustainable development, provide access to the justice for all, and build effective, accountable, inclusive institutions at all health levels. Goal 17 is to strengthen and maintain the means of implementation and revitalize the global partnership for sustainable development. So that was all about SDG. There are 17 goals, as I have already told. They are also divided into different targets. 169 targets are there, more than 300 indicators. Again, this sustainable development goal, the document of the sustainable development goal, it is also very large, right? You can also, if you are interested, go through this document. It is available in online, right? So multiple topics were there in today's lecture. It may be there that many of the topic you need to revise again and again, right? So that is all about this class. It will be also available in YouTube in whenever you want to see it. Thank you very much.